Welcome to this week's edition of our program focused on African women's health. This is a program that is committed to promotion of African women's health at home and abroad. We share the global message of health for all and emphasize that African women must not be left behind in optimal health. This is Dr. Olaide Ogunshiji of the School of Nursing and Midwifery, Western Sydney University, Sydney, Australia. Last week, we started our discussion on human immunodeficiency syndrome, also known as HIV. We looked at how it is transmitted and its risk factors. And today, our focus will be on its diagnosis, important issues for HIV testing, and we'll also look at, quickly consider World Health strategic directions. In terms of HIV diagnosis, it is diagnosed generally through serology tests, which include enzyme immunoassays to detect the presence of or absence of antibodies. This is generally used. However, there is a caution from World Health Organization saying that no single HIV test can provide an HIV positive diagnosis. So particularly if attention is paid to testing and diagnosis of HIV-exposed infants and children, it is said that this is really problematic. However, it's important to know that there are technologies that have been developed to resolve this issue. So in essence, in attempting diagnosis of HIV, it is recommended that tests are used in combination and that a specific order that has been validated or tested and which has to do and which also places context on the prevalence of the population that's been tested need to be explored. So in essence, in terms of diagnosis, a number of approaches need to be considered, not only serology tests alone, and the context of the population of interest is crucial in providing insight into diagnosis. How about HIV testing services? World Health Organization suggests that HIV testing services need to be rendered in a way that people to be tested have ability to provide consent. In essence, it should be voluntary, and that family members, healthcare providers, partners need not coerce people to have HIV tests. This is because there is need to pay attention to people's human rights as well. So simply as a guideline for HIV tests, World Health Organization suggested 5 C's. Number 1 is that of informed consent. Number 2, confidentiality, counseling, correct test result, and connection. That is, it's not enough to test people and discover that they are HIV positive. There is need to ensure that there is adequate services available for them to be connected to for immediate treatment. Let's now look at the issue of prevention of HIV. Generally speaking, prevention of HIV has to do with limiting exposure to risk factors, which we provided last week. And there are specific key prevention strategies that one can use. Number 1, there is the possibility of using male and female condom, testing and counseling for HIV and STIs. Other approaches for prevention also has to do with voluntary medical male circumcision. This is recommended by World Health Organization. And of course, the use of antiretroviral drugs. These antiretroviral drugs can be in terms of the pre-exposure prophylaxis for HIV negative partners. It can also be post-exposure prophylaxis. Now, lastly, before we round up, let's look at World Health Organization's strategic direction. There are 5 of them, and the first on the list is that of the need for information that is targeted and focused on action. There's also the need to ensure that intervention are such that have the tendency of providing the required impact. There must be emphasis on equity in terms of delivering of services. That is to say that population that need the services need to have access to these services. And number 5 strategic direction is that of financing for sustainability. That is when health services are being provided, the costs need to cover the services. And then lastly, in terms of the strategic direction, is that of innovation for acceleration. So when you and I are considering approaches to use in preventing and reducing the outbreak or even the spread of HIV, it's important to consider this World Health Organization strategic directions. And as we do this, you and I will be able to make a difference. And let's see how we eradicate HIV in a population. And that is it for me for now. I would like to thank you for your time and thank you for being there today. This is Dr. Olaide Ogunshiji again of the School of Nursing and Midwifery, Western Sydney University. And until next week when we meet again on our program, Focus on African Women's Health, I would like to say it's bye for now. Thank you.